Hello everyone. Today I present the MBA strategy and consulting project titled Novartis Retinoblastoma Growth Challenge. My name is Ajay Ramrao Khaire, roll number 02, under the guidance of Professor Dr. Chandravardhan Gotia. Defining the executive summary, our core business objective is to triple revenue from $200 million to $600 million within 4 years for the Retinoblastoma Research and Development Unit in Europe. While the current late-stage pipeline of 7 drugs is expected to yield only $375 million in projected revenues, this leaves a $225 million shortfall to reach our ambitious target. Thus, a strategic imperative exists to develop a multi-pronged growth plan that goes well beyond simply relying on the current organic drug pipeline. Let us review our pipeline. We have 2 drugs in phase 3, which typically carry a 60% success probability. These form the backbone with moderate high expected contribution. Additionally, 5 drugs reside in phase 2, each with about a 40% probability of success, but facing more uncertainty. Total projected pipeline revenue equals to 375 million against a target of 600 million, highlighting a revenue gap of 225 million. To address this, our core strategy lens focuses on new product launches and market expansion. Our key strategic levers include inorganic growth through M&A or licensing, expanding indications for existing molecules, pursuing geographic growth beyond Europe, accelerating research and development and leveraging fast-track regulatory approval, forming strategic partnership with local players and hospitals. Each of these is instrumental for bridging the gap. Our multi-pronged solution roadmap has 4 pillars. First is approach, where leveraging real-world evidence, adaptive clinical trials, and regulatory fast-track options. Focus will be on prioritizing bringing phase 3 drugs to market swiftly. Third will be strategy, repurpose existing retinoblastoma treatments for adjacent pediatric, ocular, or adult RB variants. And benefit will be speeding up regulatory approval for new indications. Contribution to the $225 million gap includes geographic expansion will prove $50 million gap, new indication exploration will fill in the $50 million gap, inorganic growth by merger and acquisition licensing will fill in $100 million gap, and the final $25 million gap will be filled by research and development acceleration. Target acquisition, smaller biotech firms holding phase 2 and 3 drugs for eye-related cancers. The rationale is that acquiring promising assets offers the fastest time to revenue and reduces dependence on an internal pipeline. Commercial focus regions are APAC, which includes India and China, LATAM, undeserved yet growing pediatric oncology markets. Partnership with local players and low-cost models are critical enablers to tap large patient pools and lower per patient cost. Risk and mitigation measures include clinical trial failures, managed through portfolio diversification and external merger and acquisition. Regulatory hurdles minimized by engaging proactively with authorities. Slow market uptake addressed by enhanced go-to-market and payer engagement plans. Competitive launches mitigated by fast-track first-mover advantages via partnership and licensing. By executing the proposed strategy, the 600 million revenue target is not only realistic but also positions Novartis as an innovation leader in pediatric oncology. The resulting contribution is balanced: 375 million organic and 225 from strategic initiatives. We will create a stronger pipeline, enable a broader global footprint, and diversify revenue streams for sustained growth. In closing, remember, the 225 million gap is not a weakness of our pipeline, but a strategic opportunity for Novartis to expand its role as an innovator and leader in global pediatric oncology. Thank you.